The following video will show you how to inject subcutaneous Ovidrel pre-filled at home. Ovidrel is prescribed to mature the oocytes for recovery. Before you begin, check against your KKIVF Center injection form to ensure that subcutaneous Ovidrel is ordered for the day. Do administer the medication at the specific time given by the nurse. Then, practice proper hand hygiene by washing your hands with soap or use a hand sanitizer. Next, prepare the following items: 1 Ovidrel Pre-filled Pen, 1 single-use needle, 2 pieces of alcohol swab, 1 container for disposing the injection, such as a disposable plastic bottle. Step 1. Set the dose. Remove the cap of the Ovidrel Pre-filled Pen. Inspect the medication. Ensure the medication is clear with no particles and that it is not expired. Turn the dose setting knob until your prescribed dose appears in the dose feedback window. Step 2. Attach the single-use needle. Clean the rubber inlay on the cartridge with an alcohol swab. Peel off the seal on the single-use needle. Attach the pen to the needle and screw the threaded tip of the pen clockwise into the needle until it is tight. Step 3. Remove the needle cap. Remove the outer needle cap by pulling it gently and keeping it for later. Then, expose the needle by removing the inner shield. Step 4. Inspect the injection site. Inspect your skin to make sure there's no bruising, swelling, hardness, or irritation in the area of the injection. Step 5. Clean the injection site. Clean the selected site with an alcohol swab and let it dry thoroughly before the injection. Step 6. Administer the injection. The injection can be given anywhere 2 fingers below the navel. Use a different injection site each time to lessen the chance of damage to the tissues under the skin. Firmly pinch the skin with your thumb and index finger and hold it. Hold the injection pen with your dominant hand and ensure that your thumb can reach the dose setting knob. Insert the needle into the pinched skin at a 90-degree angle and slowly push the dose setting knob until the dose feedback window indicates a 0. Wait for 10 seconds. Step 7. Withdraw the injection. Use an alcohol swab to apply light pressure and gently wipe the injected site. Lastly, place the outer needle cap into the needle and unscrew the needle by turning it anti-clockwise. Discard it into the disposable container. Store the medication between 2 degrees Celsius to 8 degrees Celsius. Do not freeze it. Thank you for watching this video. We hope that it has been informative.